So in summary, I've talked about the left hemispheric syndrome, the right hemispheric syndrome, emotional changes after a stroke, and also an interventional framework by which we work with patients to enhance their care. As a whole, I encourage us to focus on a couple of take-home points. The first is to understand stroke with the biopsychosocial model. Consider biological factors, psychosocial factors that can contribute to stroke, as well as post-stroke sequelae. Just have the mindset that every single patient is unique and may experience and exhibit different types of symptoms and deficits. That is very important to keep in mind. The second is really try hard to provide comprehensive rehabilitation treatment. This is based on evidence. Again, during the early stages of recovery, this is when it's most useful and effective, incorporating various therapies, various medical disciplines to enhance recovery and care. Lastly, as much as possible, try to incorporate as many evidence-based approaches in your treatment as possible. From a neurocognitive perspective, it's important to try to always enhance awareness and insight into one's deficits, because that has been found to be strongly linked to outcomes and successful recovery. Secondly, to always keep in mind the possibility of post-stroke depression or adjustment issues related to stroke. This will also impact rehab outcomes and the likelihood of prognosis as well. Similarly, visual spatial rehabilitation for neglect syndromes is one of the strongest areas of treatment that's found in the literature. Incorporating components of that is going to be crucial to, once again, enhance independence and recovery. And lastly, aphasia treatment. Aphasia treatment is key in helping one to be able to communicate effectively in order to express oneself and to feel independent. Thank you very much for letting me share my thoughts.